And as for labeling, we were open to crafting ways to figure out how to more effectively require labeling that will help assist law enforcement to determine what should be in that package. Does that summarize it?
It summarizes it to me, except for, to me it wasn't like they were just concerned about the enforcement issue, they were also concerned about people knowing.
Sure. Dosage,
Yeah,
yes.
Yep.
and cleaning up some of the ambiguity there.
Yeah, absolutely. The dosage, yeah, that was the patient aspect.
Which I think was key when we were talking to Amy Diener from the state police, was that was a way for her to identify the quantities that are possessed by each individual, and whether they can check them down and be able to do that on a roadside with no problems.
So, with that leading, I want to introduce okay, so, folks, I want to introduce to you, Joe Rukowski and Rob Titles.
Title, no S.
Title from Iron Laboratories. As we know, testing is going to be required under this new legislation, and understanding how to set up that labeling and and what test requirements are going to be super important to our businesses and patients and caregivers moving forward. So I really appreciate you guys coming out.
Thanks for having us.
And what are your feelings on the legislation moving forward, and what do you for people that are here today, what kind of input can you give them on what they can do to be better prepared?
Well, I think Joe Rukowski, he's our head chemist at Iron Laboratories, and I think he's going to be best qualified to answer the labeling questions.
So in terms of labeling, I've seen some of the most recent language kind of a thing in the bill, and there's a lot of debate as to what needs to be in there and so on, and a lot of it is a language issue, I think, in terms of making it clear, and making sure that you don't bite off more than you can chew, so to speak, and that we make the regulations too strict that nobody can meet them. Which is something that happens in Environmental Protection Act and stuff. It becomes almost so expensive that it's not even worth trying. So the aspect is what's safe, what are other states with similar regulatory things doing. And so I have looked at a lot of other states, and for the most part, the way it's currently written and a lot of the requirements that were in SB 660 that may have gotten piggybacked into this and so on, those are still very liberal compared to some of the other states. But it's not complete. It doesn't have residual solvents for concentrates. It doesn't have dosages for edibles. And then one thing I've seen that's possible is that they remove the requirement that it be tested for potency, but just that it be tested for contaminants like pesticides and mold and yeasts. So along those lines, there's no numbers, there's no set protocol in the current language so there's a lot of open and ambiguities, I guess, in that sense. Is there a blanket statement that could cover all of the labeling and all of the testing protocol? No, there's so many different ways you can look at it from a pharmaceutical or from an environmental protection agency point of view, and we want to be real careful that we don't shoehorn ourselves into something and then we're stuck with it that's too strict or too it doesn't enable us to function in the way that the laws are.
Potentially creating more liability.
We don't want to red herring.
Can you see can you see any possible solution where we could, like the Senator Richardson was talking about, bringing something to the state police that they, this dosing, maybe the dosing would give them an opportunity to be able to identify how much people have, and then again, with the dosing for the people, be able to, because those were their two concerns. I think if we can meet Richardsville staff on those two things without too many complicated changes, I think we get our home.
Addressing that, I've actually had a look at the Michigan State Police Crime Lab's protocol for testing, edibles, testing things that aren't plant materials. And it's actually the same as how they test their plant materials, and there's so many missing pieces from it that you couldn't reproduce it. And you have no idea how much of it is actually there, just that they got a confirmation that there was THC detected. And they will take 400 grams of material and dump it in a bag and mix the solvent in the bag and take a little sample of that and use one of the most sensitive machines, a mass spectrometer, to look for THC in that. There's no quantity, and it's such a strong concentrated sample prep that they start with that even if there was trace, which would be legal to ship across straight lines, less than 1 milligram per gram kind of a thing, which don't quote me on those numbers exactly. It has to be on the labeling. If it's less than 1 milligram, it's considered 0. So that's like a FDA thing with labeling. If it's less than their reporting limits kind of a thing, it's considered a 0, not like a 0.05. There's no like in between.
So, Joe, are you a chemist or something?
Yeah. Well, I have a bachelor's in chemistry from Wayne State University, and I've worked for a couple of colleges in undergraduate lab assistant, where I was responsible for maintaining instrumentation, preparing standard solutions, stock solutions, and just ordering supply, stocking, and maintaining labs. So my expertise when I started at Iron Laboratories was from a general lab point of view. I knew how to equip the lab and maintain the instrumentation needed to perform these types of tests and this type of studies. I've been working there for over 2 years, and in that time we've tested over 10,000 samples, including edibles, concentrates, and flowers. So that gives me a lot of hands-on experience working with medical marijuana. We've developed many tests over the years, additional to what we originally started with testing flowers and concentrates. Now we do edibles. We look for residual solvents and concentrates, as well as other forms of characterization that customers may want. And along those lines, we're now doing some in-house microbiological culturing and getting numbers on samples and doing controls and seeing where, these samples that pass a visual inspection, where they come out once they're cultured, like how many colony-forming units are actually on that plant and what's detectable by the aided eye. And so, as for using a visual inspection, we find that our visual inspection is sometimes it's plenty good enough if it's done by a trained person, a trained individual who knows what to look for and utilizing the proper microscopic equipment.
So all samples at Iron Laboratories are scoped by a biologist. So we have two.
So they know what to look for.
Yeah, we have 2 on-staff biologists, one plant biologist with a master's degree. So we have a highly skilled, trained staff that knows what they're looking for.
Okay, just so everyone knows, in the language for these bills, there's a new code for Iron Labs. They're going to be a safety compliance center.
We have to register with the city, just like any other
Right.
provision center.
And there's going to be, other labs that open up over the course of time, but you have to be accredited. You can't be connected directly inside of a dispensary. So, like, let's say you want to get your own mass spec. You got to create a separate location. All right. Moving forward, when I talked to you, and I told you that potency testing for edibles wasn't in the bills, you seemed surprised. And I think most people, even when we were in Richard Bill's office, they were like, I don't think we can pass this without potency testing for these edibles. What do you see, like, as a safety compliance center, like keeping our patients safe and staying in compliance with the law? What are we going to have to do as provisioning centers to develop a good relationship with, a safety compliance center, and what can we do to prepare for these bills as they move forward?
Well, the key is I do believe potency is very important to selling a product in the state. If you're not growing it yourself, you're not taking chances. You're going to a place and you're putting your faith in a manufacturer or a supplier. you want to make sure that one, you know what you're getting, that you're not getting ripped off, you're not getting less medicine than what you're paying for. But money aside from the fact, you want to make sure that you're getting what's actually therapeutic, what your recommended dosage is, or what your therapeutic dosage is that you've determined. And so that's really important. Two, it's also important that you're not overdoing it, especially with edibles. You know, when you're smoking, it's really easy to stop when you've had too much, and you feel it within seconds. You get really high plasma levels of THC within seconds after your first inhalation. Whereas eating it, it can take up to an hour or 2 hours, depending on what's in your stomach and, you know, how long it takes to get throughout the body. However, once it's in you, and it's all going to go in at the same time. So you can get a really high plasma level all at once after 2 hours later, and then you can't control that at all. So it's really important to know what you're consuming when you don't have a direct, you know, feedback as to how much is in your body. And so along those lines, edibles have such a high variability that you can get like 5 times, 10 times your therapeutic dose in a single bite. And so along those lines, I've seen people who have extremely high tolerances and very high, you know, regime of medical cannabis take a bite of something that they didn't know and just be like totally in a bad place, you know, like, and that's not, you know, these are people who can handle high doses, and they're still overdoing it.
Yeah.
So.
You know, you said you tested 10,000 samples. It gives you a pretty good idea, you know, of what's, you know, produced here in Michigan. You know, what would you say everyone here understands the difference between active THC and inactive, you know. So, you know, you guys have the ability to, you know, gauge for activation, is that correct?
Yeah.
What would you say the average activation is in a
In an
individual
edible?
unit? Yeah.
Well, to be honest with you, a lot of people, especially people who are testing with us, are getting the feedback that they need to improve their processes. So a lot of times people may come in and they're getting like, you know, a 10 to 20% activation because the product was cooked and they started with something that was like not activated at all. So it got a little bit activated in the heat process, but it's not consistent from batch to batch. You know, what rack they put it on in the oven might heat it a little bit more, a little bit less. And so in the beginning we might see 20 to 30% activation as like an average, but usually by the second to third test, everybody's in the 99% activated range. They've learned what they need to do to make sure that they're not, you know, putting more medicine than they need to for.
Can you tell me, like, you know, as far as milligrams of active THC or cannabinoids, what the average would be?
The average is probably about 20, and that's weighting towards a heavy chronic user who utilizes edibles to sustain a therapeutic dose. Most entry-level patients who are just getting into it or who are very sensitive, like an older patient or a younger patient who maybe can't handle the psychoactive effects as much, they're going to be much less. But for a heavy user, it would be like 20 milligrams. An entry-level dose would be about 10 milligrams.
Gotcha. In Colorado, they have a rule on the labeling for edibles that says that no individual, they measure a dose at 10 milligrams of active THC, and no individual unit can have more than 10 doses in it. So the total amount of active THC would be 100, and that's, you know, anything. I've had a 100 milligram dose, and it doesn't, you know, put me over the limit, but, you know, I've got a pretty high tolerance.
Yeah.
I think that, you know, 10 nanograms or not nanograms, 10 milligrams of active THC, you know, as a measurable dose makes sense.
I think that's even talked about in one of the US patents, is it not?
Yeah.
Well, 10 milligrams is a pretty average across the board for a beginner to a long-time person. A long-time person can always take more than one dose in order to, you know, I take 2, 3 Advil when I have a headache, you know. I don't take just one. So it's not, but you don't want to put 100-gram brownies out there and then, you know, your grandma has a bite of it and she's loopy for 3 days, you know. I mean,
So you agree with the dosing is key. You agree that the dosing.
But 100 milligrams is also a therapeutic range for someone who's considering it for anti-cancer benefits. So depending on what your therapeutic dose or what you're treating, the condition you're treating, 10 milligrams might be perfect, 10 milligrams might be way too much. So cannabidiol, there's no limit really on the benefit of that. but you need to kind of have the THC with it. So now the THC is going to limit the amount of cannabidiol you can put in a therapeutic dose if you're limited on the THC.
That's the issue with having limits on dosing.
Well, I think that, like, if the way the bills read right now, you are limited to having X amount of weight
Yeah.
and equivalency, but there's no talk of potency. I think that,
Potency and dosing are two different places.
Yeah,
Clear that right now. We don't want anything to do with real dosing because doctors don't even go there.
right.
Well,
But
it's
to
it's
address
a
the-
liability issue.
But to
that-
address the concerns of the state police and the patients or the Richard Bill's office, they're talking about two things. One, the cops being able to identify it on the side of the road, which gives them the ability to enforce it. We're not talking about dosing.
Listen, on our Iron Laboratories website, a client can download labels right now.
Mhm.
And how many clients do you think download the labels?
None,
Not really.
hardly at all.
Right.
Right.
But that,
But if they were had to, everyone would. If they were, if
but
it was
it's,
enforced eroding this
and
bill, everyone would.
it blows me away that people don't take advantage of the labeling.
I didn't even know I could print them off right from the website. Maybe we should put that
Oh,
there.
yeah.
Maybe we should add that to the advertisement,
Yeah.
So,
There's a couple of them out there, because,
There were,
Not
and,
very
and there was one person in particular that uses them on their products, and it's really helped them in the industry. It's been a huge factor.
Well, I see a couple different things. In other states, they've got disclaimer labels, for things that haven't been tested or only been tested in a particular way. I think that, long term, there's going to be different philosophies, both by individual centers and by provisioning centers and by safety compliance centers. But I kind of, see these labels and the testing being key to how we move forward, and the legislation, can give guidance on a standard, but it doesn't necessarily always set a particular standard because it doesn't lay out procedures and things of that nature. So,
I mean, it could be addressed by individual cities,
yeah.
labeling.
Well, that was one of the biggest concerns that they had, on a statewide level, is state police, law enforcement, they can't look at 30 different labels. It's just not practical for them. They're not going to allow a bill to pass that would allow that. So we have to fix that for them.
So we currently show, when we test on edible, we have activation rate, and you have milligrams per gram, and you have milligrams per serving. So that's there right now.
And
So you're doing what they want. If we could, it sounds like you guys embrace what we're talking about, and if we can approach with
It's
something
not that we
and
embrace
stay away
it,
from
it's
dosing.
just an obvious
it's an obvious thing.
thing to do. I mean,
Right.
All right, so, since we're seeing that potency testing for edibles is going to go into place, and we all know that batch testing is going to have to be done for our flower products, I think that, starting a relationship with, a potential safety compliance center makes sense,
Oh, yeah, I mean,
are you concerned about, an influx of business after these bills passed? And, I mean, personally, I would want to have a good relationship with you before these bills pass, so I'm not like, I gotta get my stuff
well, I
tested,
mean, that's,
waiting in a big
that's what it's
line.
all about, is having, communication, with our clients, and, we are clearly, ready. I mean, we have a new facility, so.
Let me address that a little bit. So the way we're operating right now, we have a very good business model that allows the small guy to play in this game. It doesn't exclude them and push it to a corporate level. And that's what the Michigan Medical Marijuana Act did in the first place by limiting it to 12 plants. They wanted to keep it in a small-time operation. But ultimately, it doesn't benefit from scales of economics, and it's very short-lived. So maybe they saw that no one would be able to grow, and this wouldn't be able to grow, and it would eventually suffocate itself out. But when that didn't happen, when people were able to function, and people were able to play that game. And so it's real important to keep the small guy in this, so that with the legislation that does pass, we don't want that to change. But with the regulations that do get added on, that are important, that are necessary, we expect to see the larger operations to step up to that new standard. The old system will still work for patients and caregivers who aren't required to test, and will still be able to produce their own medicine and so on, and get it tested if they want to. So along those lines, we want to encourage people to get in the habit of putting that extra $40 aside per batch. It's not much, especially when you look at the grand scheme of things, and incorporate that as part of their model, so that when it does become regulation, or when they're not complaining, oh, I got to change all of a sudden. Well, no, you don't have to change. This has been in the pipes for over 2.5 years, and there's all kinds of different levels of services to suit any size business, so that